specific encounter with a patient today that I thought could be good to talk about, because it's quite frankly something I believe that physical therapists deal with quite a bit, which is a patient that is crying or very emotional. This definitely is something that happens somewhat regularly, I feel like. For me, I wouldn't say necessarily every week, but definitely happens regular enough to the point where I think it's important to talk about. And I'm just curious to hear some of your all's thoughts on how you handle these situations. A good example is today I had the front desk message me that one of my patients was here, but that she was crying, and they didn't know what was going on. So I went up there and briefly asked her, like, hey, are you doing okay? And she was still crying, like, kind of hard, and got her some tissues, and we went to a room where we could talk privately, which I think is important because you never know what they need to talk about, and a lot of times they might not want everyone to hear those things. So we had a chance to talk about what was going on, and just a phone call she had gotten regarding a court case that was coming up. And basically my analysis was she has a little bit of trauma from a certain event that happened to her, and it caused her to become very emotional before coming to PT. She had just gotten that phone call before PT. So I gave her a chance to talk about it, and I think that's a really important thing to do, is when someone's crying. Sometimes maybe it's obvious, maybe they're in pain and they're talking about how it's affecting their life, but at least in this situation it was actually something a little bit beyond pain. And I think it's important to give patients a space to share what's on their mind. I know that we are not psychiatrists or counselors and what have you, but it's still just quite frankly a part of our profession to at least know how to handle these emotional outbursts, I guess you could say. And I think it makes a big difference on how we handle it. I also did take time to ask her if she was seeing a counselor or a psychiatrist or anything like that pertaining to just some of the emotional issues she was having regarding this incident she told me about. And she has just recently gotten set up with a psychiatrist and has had one session with that professional. And I think that, at least in this case, that was definitely an important question to ask, because there was some trauma involved with this incident. And I think it's important for us to at least help steer the patient towards a professional who deals more on the psychology side of things. But I also think it's important not to use this as, I don't want to use this as a cop-out, basically. I still think there's something we can do to help the patient in that moment in their therapy session that is within our realm of practice. So after giving her a chance to talk about it, I gave her the option to go ahead and go home if she needed a day to just be to herself and reflect, and basically take a mental health day is what I like calling it, what I've heard other people call it. And she decided that no, she wanted to be in therapy to take her mind off of that and just focus on some other things. She was still pretty emotional, but I was like, okay, well, let's go for it. And I actually went ahead and did some deep breathing with her, had her close her eyes. I asked her what the most calm place is she could think of, and she told me about a place she likes going to watch the ocean. So I told her to imagine herself there and do some deep breathing. And after doing that, we were able to do some physical therapy. That's the way I handled this particular situation. I might not handle every situation the same way. Some patients simply just need to talk about something, and then we move on, or I at least affirm their frustrations or the issues they've been having regarding their condition or their pain. And then ultimately, though, I always try to move on to the next thing, because physical therapy is ultimately a place for physical healing, and I always want to keep moving in that direction if the patient can. So go ahead and share your thoughts, like, how do you all handle situations like the one I had today, or just other situations where a patient is crying? Maybe you agree with what I did, maybe you have some other thoughts, something to add to it. Feel free to take away from any of my tips on the matter. But let's talk about this. How do you handle these situations? Go ahead and comment below.